Okay, so we are going to be talking about moral injury today. So, understanding what moral injury is in first responders, starting off with an overview of what moral injury actually is. And this might be a little bit of it's a bit of a moving target these days. Now, we've heard of moral injury was first coined in 1994, but the definition has since evolved, and we still haven't settled on a unanimous consensus on what it is defined as. And so I'm going to just take you from the start and just do a brief overview of moral injury. So, as I said already, it's an evolving definition that was first coined in 1994. It's often an overlooked experience. Now, this is because it is not uncommon for moral injury to co-occur with PTSD. I would venture to even guess that it gets overshadowed by PTSD because there's much more awareness around what PTSD is versus moral injury. And it can sometimes even be mistaken for PTSD because the manifestation of each are very similar, but the pathway and how we get there is significantly different. So we will be talking about the difference between the two. And despite what I was hopeful about when I heard about this on Monday, it is still not in the DSM. So it is still not technically a mental health diagnosis yet, which is also a reason why it goes unnoticed, is because up until last week, it was never even mentioned in the DSM. And I'm going to explain what I mean by that in a minute. Okay, so according to Shea, 1994, the first who coined it, moral injury is a betrayal of what is morally correct by someone who holds legitimate authority in a high-stakes situation. So Jonathan Shea, he's an American psychiatrist who worked with Vietnam soldiers, Vietnam veterans, and this was an observation of his based on the work he was doing with them. He said this was different than PTSD, what he was finding. And so examples in his experience and observations were reckless or dishonest orders. This is coming from their experiences in Vietnam. Reckless or dishonest orders, leadership failing to protect soldiers, witnessing atrocities. Words are hard today. Condoned by authority or being punished for doing the right thing, as well as dehumanization towards Vietnam civilians. The impact of this, in his observation, was loss of trust in leadership and institutions, erosion of character and moral foundations, with profound anger, grief, and alienation distinct from fear-based PTSD. So this was already the start of determining that there was another experiencing happening that was different than PTSD, which was something that they were also witnessing in Vietnam vets. Okay, in 2009, Brett Litz introduced an evolving definition of PTSD. So he took Shea's research and expanded the definition to state that moral injury was perpetuating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. So whereas Shea was about the authoritative figure, Litz expanded it to say, no, it could also be us. It could be the everyday person. It could be the person leading as well as the one being led. Now, transgression, if you've not heard that word before, is defined as an act that goes against law, rule, or code of conduct, particularly your own personal code of conduct. So do you betray something that you hold to be true and authentic to your character, your moral character? Do you betray that by transgressing? Similarly, though, he believes that this may entail participating in or witnessing inhumane or cruel actions, failing to prevent immoral acts of others, as well as engaging in subtle acts or experiencing reactions that, upon reflection, transgress one's moral code. Still, they agreed that the impact was guilt, shame, self-directed anger, and still distinctly different than PTSD. Now, in 2014, Shea addressed these differences. He believed that there were now two definitions for moral injury, which, from a researcher's perspective, that's a bit messy. You really should only have one consensus and one term to describe something if you ever want to get anywhere going forward with this. You want to make it a diagnosis, you want to have criteria for it, you want to study best practices for treatment. It really starts with a consensus. And so that kind of is a challenging part of moral injury and maybe contributes to why it gets overlooked. Again, Shea believed that this was a betrayal by authority, whereas Litz believed this was a betrayal by self, which could include authority. Different origins, same devastating outcome. So they were just looking at the same outcome from a different lens. Okay, then American Psychiatric Association entered the chat last week. Now, if you're not familiar with the APA, they are to therapists what the American Heart Association is to healthcare providers and first responders. They aren't the end all be all of everything, but they have a lot of stake and real estate in their arena and their authority. And a lot of times the things that they say is what everyone else follows. So there was a paper that was published in March that proposed, hey, we have too many different definitions of this. We need something that encompasses moral injury more so on a spectrum, so moral trauma. And they recommended that, they recommended a couple of different definitions and clear definitions for each of it. And the APA got a hold of it and said, okay, best we can do is moral problems. So they created a whole new term to put in their DSM supplemental info. So without getting too into the weeds of it, what I want to clarify, and the reason I want to clarify this is there's some very big institutions that are cheering and being like, hooray, moral injury is now in the DSM as a clinical diagnosis, and it's not. It's just not. So if you see anything around that, know that it is in the supplemental info under something called conditions that may be a focus of clinical attention. So this is alongside moral problems, is alongside spiritual or religious problems. It's alongside homelessness, challenges with transitions, basically the little life things that make depression harder, that make anxiety harder, that make PTSD harder. So from a therapist perspective, they might code these things and go, okay, this person might have PTSD, but they're also struggling with homelessness, or they're also struggling with a really nasty divorce. So they'll code that. So basically, what we have now is that moral injury has been added to those supplemental areas as moral problems to include experiences that disrupt one's understanding of right and wrong, sense of goodness of oneself or others, or institutions. So overall, it is a step in the right direction because at one point, prolonged grief was in this same section of supplemental info of the DSM, and a couple years ago, it graduated into an actual clinical diagnosis. So this may just be the first step, but we don't know why the powers that be make the decisions that they do. Okay, so let's talk about moral problems as an overview, because when it talked about the reason for change, it did include a couple of terms that I want to go over, which one of them is moral dilemma. So moral dilemma is the conflict, okay? This is the foundation present of everything that may or may not lead to a moral injury. This is situations in which a person faces two or more morally justifiable but mutually conflicting courses of action with no clear right answer. This is your classic, we've all been a part of an activity where we talk about a moral dilemma, and you have to decide which of these two options is going to be the right one. And it really depends. It depends on a lot of things. So that's the conflict. That doesn't, just because you have a moral dilemma does not mean it's going to cause distress. Okay, so distress is the constraint. This is the experience and emotional consequence of knowing the right thing to do while being in a situation where constraints make it nearly impossible to pursue the right course of action. I can think of a number of times where I was in a situation where my hands were tied and I couldn't do something, and it caused some distress, but it didn't lead to injury. Injury is the big one that causes a lot of problems. Okay, so moral dilemma is usually the thing that's present that gives you the recipe for moral distress occurring or moral injury. But moral injury is the lasting psychological, social, and spiritual harm that occurs after perpetuating, failing to prevent, or witnessing acts that transgress deeply held moral beliefs or expectations. So if you haven't picked up on it by now, it's not always the act of doing something. Sometimes it's being the bystander and not intervening for one constraint or another. It might be because you don't feel confident enough in yourself to step in and stop the other person. It might be a hierarchy thing where the point of authority, you don't have control or you don't have authority over that person. It could be because you didn't think it was that bad until hindsight, you're reflecting on it. There's a number of things. Now let's differentiate it from PTSD. Okay, PTSD versus moral injury. Okay, so PTSD is a clinical diagnosis, whereas moral injury is a potential clinical problem. PTSD is a fear-based experience, whereas moral injury is a shame-based experience. We're going to talk a lot about shame before the end of this. PTSD is caused by exposure to life-threatening or traumatic events, whereas moral injury is caused by perceived violations of deeply held moral beliefs and values. The other thing I didn't mention yet is what also makes this a bit of a challenging concept to learn about and identify in others is it's very relative to the individual. So what I find to be a violation of something I hold true is not necessarily going to be the same thing that you find to be morally valuable in a violation of that. And I'm going to show you a really good, I shouldn't say good, but it's a very good example of a moral injury. And all the different players that are involved, many of them one person could have felt violated, that they violated their moral beliefs, while another person would feel violated if they of their moral beliefs of a different action. And that'll make sense in a little bit. And then the outcome of this with PTSD is functional impairment, substance use, depression, suicidality. With moral injury, self-sabotage, substance use, and abuse, loss of trust, meaning, and suicidality. So there is some common overlap, and these aren't all encompassing either. I just didn't want to flood your page with too many words on it. But a lot of the manifestation of each of these look very similar. Okay, let's talk about some examples of moral injury, and starting off by the disclaimer that moral injury cannot be measured solely by the event. It is defined by the individual's perception, interpretation, and moral framework. So this is what makes it very relative, like I said. Resources during COVID, especially in the healthcare setting, particularly in the hospitals. If you've been watching episodes of The Pit, they've got some very good examples of what that might have looked like. I think that truly it might have been COVID that is going to start pushing moral injury, the needle around research and acknowledgement, recognition of what moral injury is. But that's a great example. Say they had too many patients, not enough vents, had to make decisions about who was pulled off the vent first, and so forth. And again, events that might cause moral injury. This did not cause moral injury for everybody. In law enforcement, having to use lethal force, maybe there's this, challenge with you did what you had to do to save yourself and act in a manner that was in the best interest of yourself, your partner, and your community. However, at the end of the day, it might be challenging to grapple with the fact that a human being is still dead. Mass casualty incidents could potentially do this as well, especially when there's a limited amount of resources, similar to what we talked about with COVID. In your personal life, decisions about a dying family member. If you have a terminally ill parent and there is a conflict of decisions between the adult children about whether or not there should be a DNR, someone might feel like it's a moral violation to not try something, whereas someone might feel like it's a moral violation to disturb the dying process. Receiving facility treating a patient poorly. So let's say you have a critical patient that you were able to stabilize enough to transport to the hospital. You hand it over to the receiving team, and they undo all the work that you just did. And you have to stand by and watch them mistreat or not properly take over the care that you handed to them. And you watch your patient deteriorate and die because it's not your patient anymore. They're handed off to the team. They're off your gurney. They're on the ER's campus. That has happened to me a number of times. Med errors and clinical errors, including the act of omission, meaning not doing something. This one, I think, at least for EMS, I suspect that this one probably contributes to moral injury quite a bit. And my theory, and this is 100% my theory and just some food for thought, is that I firmly believe PTSD exists. I know that there's only so much trauma we can bear witness to before it has an impact on our psyche, especially if we don't have good hygiene and we don't take care of ourselves along the way. But how many of us, especially when we're brand new in this field, we're like, I don't want anybody to get hurt, but if they do, I want to be the one that gets to help them. And got excited about a trauma and got excited about a RIP and TC and all these things and got to like do these really important things. I think that when we were called up to do something really critical and really practice the skills that we learned in the classroom, when we did it poorly or we made a mistake, that can cause a moral injury. And it's that rumination and that shame of I messed up, I embarrassed myself, I had a med error, all of the things. But that's just my opinion and theory. Maybe witnessing systemic injustices or racism and not being able to stop it, not speaking up to stop it. Transport decisions. Let's say you have a patient who is absolutely a DOA, but they're in a public area. And so you're grappling with the fact this could just cause a little moral distress, maybe doesn't cause moral injury, but let's say it's a matter of whether or not you're going to transport a dead body just because of social circumstances, and do you feel confident with that decision? Or let's say this person is absolutely DOA, no question about it, but they're another public servant, or they are the family member of somebody you know, and you feel guilty because you want to work, you want to do something to show them that you tried, because now it becomes personal. This can cause some issues. I was in New York last December. I think I was in Queens, and they were telling me that when they have a STEMI or suspected STEMI, so having a cardiac myocardial infarction, they have to call the hospital and they have to speak to the doctor, and the doctor has to confirm that they received the 12 lead. And it's not until they speak to the doctor that they are allowed to get wheels moving towards the hospital. And a lot of times the line gets jammed up and they're waiting to speak to a physician. So they're just waiting there with someone who's infarcting, and they're not allowed to get going to the cath lab, which is what the patient needs, until they get the okay from the physician. And if they deviate from this, their license is compromised. So you're stuck between a rock and a hard place, because it's like, well, do I transport this patient who could go into a cardiac arrest in front of me and risk my license and go against what the rules are telling me to do because it's taking too long to get a hold of the doctor? I don't know how often that actually happens, but this was an example they gave me. Or do I wait until they die in front of me and I have to live with that? Because then you can transport once they're in a cardiac arrest. So that's another place where that could happen. Insurance barriers to patient care. I am blanking on her name right now. There is a physician who is gaining a lot of popularity. She has a surgical clinic in, I believe, Austin, Texas. And in the middle of a surgery for her patient, she gets a phone call from United Healthcare denying the claim for the surgery that she is in the middle of performing. And so she gets on social media and talks about this, saying that the insurance companies keep tying her hands. They keep playing doctor. They keep telling her what she can and can't do with her patient. And that is causing moral distress, potentially moral injury, when she knows what they need and she's being stopped by an institution telling her she can't do that. And then to add insult to injury, United Healthcare is suing her for talking openly about this. But it's a great example of where insurance barriers to patient care can cause some challenges for healthcare providers. And then accidental or collateral death. If you're responsible for an accident that as a result kills other occupants in the vehicle or in an opposing vehicle, that can certainly cause moral injury. There is a gentleman that I've developed that I've had quite a few conversations with in my DM, my chats, and he gave me permission to share this, but he's a retired firefighter. And when he was in his 20s, he was a pilot for a commuter plane for a small airline company. And he had told them, like, I don't feel comfortable taking this flight because of X, Y, and Z and the weather and all these things. and they forced him to do it anyways. And shortly into the flight, he crashed. And of the 9 passengers on board, 6 died instantly. And so that has caused a significant amount of, on top of PTSD. I mean, PTSD was absolutely a part of this. The 4 that survived was himself, the pilot, a politician, a law enforcement officer, and the inmate that was shackled to the law enforcement officer. So the 4 of them were out in the wilderness in the middle of winter in Canada, waiting to be rescued. And it's been written on, a book was written by the daughter of the politician. They developed a relationship after that. The politician, his family, and the pilot. And she wrote a book called like Into the Abyss. I'm not, just it sounds like a pretty interesting story. I have not read it, but I've talked to him personally about it. And it is a very unfortunate example of what that looks like, because one of the challenges, and I'll talk about this again later, is that there's this lack of feeling worthy of forgiveness. And that's something he said. He said, I don't deserve to be forgiven for this. And this happened 30 some years ago, and he lives with that every single day. Okay, so we're going to look at a video, an example of moral injury. This was a video that I spotted on social media. I reached out to the creator. I asked permission to include this in our presentation today. And I want you to consider a few questions as you're watching this, which is, what did the patient want? What did the patient's family want? What did the providers want? And then I want you to also ask yourself, who ultimately made the call, and whose decision was it? If you were to pick one party, because there are 4 involved, whose decision was it? Who had the right to make the decision? And I would almost guarantee, if we were to do a poll, and we can talk about it at the very end when we do the Q&A, I can almost guarantee many of us would have conflicting answers, or I should say a variety of answers, not conflicting. It just depends where your moral values align. Okay.
I had to enter an order that went against everything this woman believed in. She was a Jehovah's Witness. 2 doctors documented that she did not want a transfusion. She said it clearly, even if it meant dying. When she couldn't speak for herself, the hospital listened to her kids instead. I get it. They were scared. They weren't ready to lose their mom. But it wasn't their choice to make. The risk team made the call. I had to push the order. And the sad thing is, she died anyways. I couldn't write what I wanted in the chart, so I wrote it somewhere else.
So the 4 parties were the patient herself, her adult children, the doctors, and risk management, who ultimately made the decision, because they made it a legal conflict rather than the, ethical, moral conflict of this. And the thing to remember about this is, while this person, this healthcare provider, feels like her moral compass was violated because she wanted to honor the patient's beliefs and requests, another physician who thinks, I have a dying patient, I have a solution for a dying patient, may feel like they're violating theirs by withholding the blood. And then the children have their own, challenges with it. And then she dies anyways. It's heartbreaking to think about. But that is ultimately the messiness that moral injury is. Okay, so let's talk about the consequences of moral injury, what it looks like when we are morally injured. Okay, the biggest one is going to be suicidality. There is a high correlation between suicidality and moral injury, especially in high risk environments, law enforcement, first responders, healthcare providers, veterans. There's a study that was just published that we'll talk about in a minute. Loss of trust impaired capacity for trust, elevated despair, interpersonal violence, demoralization. So this is the psychological distress marked by a feeling of hopelessness or helplessness, loss of meaning, a failure to cope, self-harm, self-condemnation, so blaming oneself over and over again for the thing that happened or the thing that you couldn't prevent, erosion of oneself, so one's sense of self, so losing like your core identity and who you thought you were. Guilt is almost always present with moral injury, but shame is the more corrosive of the two. Even though guilt and shame get used interchangeably, they are very, very different experiences and emotions. Most people, I don't want to be absolutes here, but usually when we feel shame, we would have felt guilt. Not everybody who feels guilty feels shame, but usually everybody who feels shame felt guilt as a foundation to that. Okay, so let's talk about guilt versus shame. Okay, so this is based off of the work of researcher Brené Brown, who says that guilt is just as powerful, but its influence is positive, while shame is destructive. Guilt is feeling bad about our actions, which can motivate us to change. Shame is feeling bad about ourselves, which corrodes our sense of self-worth. Okay, so difference. Shame focuses on self, guilt focuses on behavior. Shame is I am bad, guilt is I did something bad. Okay, so you're already sensing the difference in embodying the mistake versus identifying it as something outside of yourself. Shame is positively, not in a good way, positively correlated with addiction, depression, violence, and suicide, amongst many others, whereas guilt is inversely correlated with these things. The thing about guilt is it can be a motivator for change. So, for example, I like to use this as an example. I am marrying a wonderful man next year, but he can't find the laundry basket. He just cannot do it. Like, of all the things that are great about him, he will leave little, like I call them gifts or trails. Like, you know which path he took getting in the house because there's just stuff laid everywhere. And if I make him feel guilty, I've realized this. I didn't do this on purpose. But if I make him feel guilty, he'll pick it up. He'll fix it. But if I make him feel shame, that'll start a fight. There is a difference. So guilt can be a motivator for change. It helps if the guilt is, not externally imposed. So now that I recognize that I do that, I try better not to. And he's a little better about picking up his clothes. But guilt can be very beneficial to us because it tells us that something's wrong, that we missed the mark, and that we have the control to fix it. Shame leads to secrecy, isolation, and withdrawal, among a host of other things, whereas guilt can motivate repair, increase accountability, and growth. Again, the outcome is destructive versus adaptive. Now we're going to watch a video by Brené Brown where she kind of summarizes what we just went through very well and adds a couple of extra points.
Shame is the gremlin who says, never good enough. And if you can talk it out of that one, who do you think you are? The thing to understand about shame is it's not guilt. Shame is a focus on self. Guilt is a focus on behavior. Shame is I am bad. Guilt is I did something bad. Shame is highly, highly correlated with addiction, depression, violence, aggression, bullying, suicide, eating disorders. And here's what you even need to know more. Guilt inversely correlated with those things. Shame for women is this web of unattainable, conflicting, competing expectations about who we're supposed to be. For men, shame is not a bunch of competing, conflicting expectations. Shame is one. Do not be perceived as what? Weak. If you put shame in a petri dish, it needs three things to grow exponentially: secrecy, silence, and judgment. If you put the same amount of shame in a petri dish and douse it with empathy, it can't survive. The two most powerful words when we're in struggle: me too.
So what's important to recognize about shame is that it's the when we're ashamed of something, we are carrying the shame that we are the problem, that we are the broken thing, that we are the bad thing. We don't exactly share that with anybody else. And that secrecy and that silence and that wanting to hide that behavior, hide that action from someone else just potentiates the moral or the psychological injury to us. And which is why this leads a lot of the times to the self-harm, the substance abuse, the isolation, the suicide. So it's a very erosive thing. Okay, so let's talk about what the research says. First off, as of 2019, I think this there might be a change post-COVID, but minimal study of moral injury outside of military-related contexts. There was a comprehensive review done in 2019 with 116 papers reviewed on moral injury, and only 5 to 10% were made up of first responders, including law enforcement, but also healthcare workers. So that's a very small percentage of the research. The rest was done on military. But again, it's kind of like PTSD. We came up thinking PTSD was just a military thing and that it didn't happen in other professions or in outside of combat. And this is just kind of the similar evolution that I think is taking place with moral injury. Exposure to potentially morally injurious events is not automatically a moral injury. Could it cause some moral distress? Could it cause absolutely nothing? Yeah, so you could be, like we talked about a few slides ago, you could have some exposure to a moral dilemma, but that doesn't mean it leads to any fallout from that. And then a study that was just published a few months ago found that those first responders who met screening criteria, that those with PTSD had much greater levels of moral injury across the board. So it wasn't just bad enough to have PTSD has been found, we talked about this on Monday, has been found to have higher occurrence of major depressive disorder. They're also finding that it has higher occurrence of moral injury as well. And so, like I said, I think that moral injury often co-occurs with PTSD, but I think it also, PTSD has overshadowed moral injury in identification. So I think it's been there for a while. We just haven't seen it all along. Now, this is the one that is really telling, which is that, and this was part of this study from a couple months ago, moral injury is independently associated with suicidal ideation and suicide attempts in high stress, service-oriented occupations. So this study was published just a month to 2 months ago to explore if moral injury predicts risks of suicide beyond PTSD and depression. So they ruled out PTSD and depression. They just wanted to look at people who had moral injury only. And what they found, and they surveyed over 1,200 first responders, military veterans, and healthcare workers, pretty robust amount of people to survey. And they found that those with moral injury were 6 times more likely to have attempted suicide, just with moral injury alone. These are not people who also had PTSD. These are not people who also had major depressive disorder. And that's the eye-opening thing. Like, this study is big. If you, I mean, we're in Suicide Prevention Month, Suicide Awareness Month. You want to know if there's more that we could do? Know what moral injury is, educate more on it, work with clinicians for your providers that know how to identify and work with moral injury. It is the source of a huge problem that we have in our industry, and we're barely grazing the surface of understanding it. Okay, so let's talk about repairing the wound, therapeutic approaches and practical applications. Now, this one's a little tricky because it's technically not a medical diagnosis. It's not a mental health diagnosis, so it has not yet been studied extensively as far as interventions go. That doesn't mean there isn't hope or help. It just means there's still a lot to learn around this. So everything I'm sharing here is the best we know. None of this is to be taken as the gold standard by any means. Okay. So treatments for moral injury are in a formative stage of development and scientific examination. No validated treatment for moral injury currently exists. There's no gold standard yet. Okay. Here's a couple of practices, though, that have been used. This one is the one I was talking about earlier with the gentleman who was the pilot. I think, this is just me putting my plug in here, when there is a denial of forgiveness, it's going to be really challenging to heal from that. I'm not saying it has to be the first step in healing, but he's not the first person I've spoken to that speaks about something that sounds like it would be aligned with moral injury, that doesn't believe they deserve that forgiveness, that they don't believe that they deserve to be let off the hook for the thing that they've done. And they are just really committed to going 9 rounds with themselves. So that has to be something to be considered. Some actual therapy practices would be acceptance and commitment therapy, trauma-informed guilt reduction therapy, also known as trigger, restore and rebuild therapy, and even EMDR. Now, none of these were studied specifically with moral injury as the outcome of whether or not it was effective for it. But things like acceptance, guilt reduction, restore and rebuild, these are elements that affect and make up or challenge recovery from moral injury. So they are thought to be helpful for these things, particularly trigger is what I've heard. Because like I said, guilt is still a part of it, even though, shame is the destructive of the two. And then EMDR really helps to really rewire and reprocess how we perceive things. So EMDR is the second chance for us to go back and tell the story more accurately or give ourselves a little bit of grace in hindsight. Now, if you remember from Monday's lecture, we talked about the importance of sleeping after a traumatic event or after a really bad shift, or, I'd say on top of that, if you had a shift where you really messed up or you feel like you didn't do your best, make sure you sleep, because in your sleeping state, in your REM state, you're doing the rapid eye movement thing. And in this period, you are actually filing away the day's events into your hippocampus. And when you interrupt that by staying up all night, drinking, or drinking a lot of alcohol or substances just to fall asleep, we interrupt that REM, and then those memories don't get filed away properly. That's what EMDR can go in and manually do for you, though. I have a friend who you may have, if you've gone to any conferences in the last couple of years, he was stabbed on a call, a routine medical aid specifically, in San Diego, my friend Ben Vernon, and naturally developed PTSD from it. This man tried to murder him, and he had a great deal of PTSD that occurred as a result of this. But one of the things that stands out to me about his story is when he finally started working with his therapist, who ended up saving his life. When he ended up working with his therapist, he started doing EMDR. He didn't really believe in it. He's like, what is this? Ended up being like the number one thing that helped his PTSD. But one of the things that they rewrote, because he kept bringing it up, because he wasn't the only one who got stabbed on the call. His partner, Alex, also got stabbed. And he kept telling himself, like, I wasn't there to save him. I wasn't able to help him. I didn't have my trauma bag. I was unprepared. And he kept telling the story, and his therapist, who was a retired cop, goes, hey, Ben, you keep saying that this was a routine medical aid. Why would you have your trauma bag on you? And it was that shift for him. They went, oh, actually, because he was just stuck in this loop thinking, I messed up, I messed up, I messed up. But there was no reason why he would have had it, nor was he in any condition to do anything but try and breathe, because, the guy collapsed his lung immediately and he almost died. So that said, EMDR gives you a chance to reprocess what might not even be true of the occurrence of the event. And lastly, this one might come off a little weird, but community and storytelling. A lot of this is coming back to the fact that these events, these experiences, these mistakes we live with don't go away on their own. In fact, they grow the longer we keep them secret. And I'm not saying to get on a TikTok live and tell the whole world about it. But certainly there's got to be at least one or two trusted people in your life that you can share and express this with, particularly a therapist, to work through these things. But these things don't go away on their own. They don't go away on their own. And being in, if you've ever had a med error and you open up to somebody you really trust and look up to, and they're like, oh yeah, I had one too. You're like, oh, I'm not a, horrible person. If somebody that I regard as like a very high functioning, respectable clinician has also made a mistake, I'm not such a horrible person either. And that's what happens when we share with our community, at least the people that we trust, right? So moral recovery practices. The main goal is to help individuals build, restore, and maintain supportive and healing relationships and social experiences, namely valued and valuing connections with intimates, friends, and groups that foster personal and collective humanity and belonging. We'll have a little time for discussion, but I just want to show you how you can get a hold of me before we stop the recording and open it up for Q&A. Thank you so much. I really appreciate the opportunity to be here with you all.